And we are back on the WHHI-TV Daily News. Joining me again is TK Curtis-Pugh. She was here recently talking about honoring nurses for National Nurses Week, but today we're going to jump a little bit further into talking about the shortages and some of the programs to help alleviate those shortages. So thank you for being back, TK. We appreciate it.
Thank you for having me.
So as I mentioned, last time you were here, we kind of really did touch on the shortages, so you could just do a real quick recap on that. But then I really want to talk about the programs that you have in place to try and help alleviate that.
Sure. So South Carolina is positioned to need about 13,000 nurses over the course of the next several years. So we definitely have about a 20% deficit in what we need to take care of our patients here. One of the great things that we do have, and I'll segue a little bit into that program, is the South Carolina BOLD program. So we have partnered with the South Carolina Student Loan Corporation to be able to provide monies to help people who want to go back to school, who want to get their student loan debt wiped or at least alleviated. And that's one of the things that nurses are afraid of, because it costs a lot of money to go to nursing school and to advance your career. But this program allows nurses who are getting their master's and or doctoral degrees to be able to go almost practically free. It pays about $30,000 a year, with the caveat that that nurse is willing to teach in an academic setting for 2 years. So it's a win-win. We're able to increase our faculty, but we're also able to provide a way for people to not be in such high student loan debt. So I think it's a great way to make sure that everyone is getting what they need, and hopefully we are allowed to be able to increase that pipeline. And then the other program that I'll mention is Stand Up SC, which is a program for disenfranchised and disadvantaged students who come from marginalized communities who may need some of those other support mechanisms to be able to be successful in their nursing programs. So it is a grant-funded program through the University of South Carolina, but it pipelines into every nursing school in the state. So it's really nice when no matter where you go, you have an opportunity to be a part of Stand Up. So those are two big programs here in the state that are really, really pushing the needle forward.
Those are big programs, and really, goodness, such great help for those people that want to get into the field. I appreciate that so much. And I know there's some legislation that you wanted to cover as well, and maybe touch on the fact that we do definitely need OB/GYN nurses to deliver some babies around the state.
For sure. So South Carolina has 17 counties that have no OB, meaning you would have to drive to another county in order to have your child. Wow. So one of the things that we are working with, the University of South Carolina has just launched a certified nurse midwifery program. Is the first in the state to be able to create and grow these certified nurse midwives who act as a bridge between our OB/GYN physicians and our patients. They are able to deliver babies. They are able to take care of mothers pre and postpartum, and it really is a way for us to bridge the gap in South Carolina. And I'll bridge that with our legislation. So the first one is Senate Bill 45, which is to advance APRN practice. It is not to change the scope in our state, but it is to remove the collaborative agreements that we currently have in place that don't really serve our communities well. It really puts us in a position where nurses and nurse practitioners are not able to work at the full extent of their education and their licensure. So we're working on getting that done, and that includes those certified nurse midwives. And then the other one, we talked a little bit when we talked last about the workplace and the burnout. And one of the things that attributes to burnout is workplace violence. Nurses are attacked, nurses are verbally and physically assaulted, and we have to make sure that that is something that has real penalties behind it. So we have Senate Bill 346 that is currently in play, and we'll see more about that during the next legislative session. But we hope that it looks at all healthcare workers, not just nurses. So we want anyone who is taking care of your loved ones and or you to feel safe in their workplace, because that prevents them from being burnt out, and it also prevents them from not wanting to be a part of the profession anymore, because people walk away from the profession because they don't feel safe. So those are some things that are happening right now that we really want to focus on, and we want people to get involved, get engaged. If you're a nurse, join the association, and if you're not, continue to support the work of nurses, because we support the work of healthcare.
Well, TK, again, fabulous information. Thank you for sharing about those programs with us. Really great to get people into the field. And that's some important legislation that we should all be supporting. Again, thank you for being here to share all that with us today.
It is my pleasure. And on behalf of the nurses of South Carolina and the American Nurses Association, thank you all for having us, and thank you for highlighting nurses.
Absolutely. And we'll be back with more, so stay tuned.